Hi there, Dr. Sasse here from Nevada Surgical Associates. I was asked a question recently about, are there any side effects of metabolic surgery that I really need to know about before I start embarking upon that journey? And of course, every surgery, every health intervention, every medication, every treatment always has some pros and cons. There's always some positives and there's always some potential side effects or complications. Metabolic surgery is certainly no different. So it really boils down to the type of procedure and then the specific types of complications related to that procedure. So I'll just give kind of a sort of a nutshell overview of this. I go through in a lot of detail in my book, which is Outpatient Weight Loss Surgery. And so you can read a lot more detail about that if you want to find that on Amazon. Not to put a shameless plug in there, but just to tell you where there's more detail. But with the sleeve procedure, which has become the #1 procedure around the country and around the world, there are far fewer side effects and complications, there's no doubt. The #1 of them is probably gastroesophageal reflux or heartburn reflux that people can get afterwards. It's true that the studies show most people actually improve their reflux. Surgeons like us who really make an effort to tighten the hiatus and also prevent acid reflux have a very high fraction of people who improve, reduce, or prevent acid reflux. But nonetheless, there is still a fraction, and it might be as low as 10 or 12% of people will get new or worsened acid reflux after the sleeve procedure, probably related to the smaller stomach and the change in the motility or the emptying of the stomach after the sleeve is performed. And so that's the #1 side effect, usually controllable with medications, but in a few cases it could require revisional surgery to solve it. The second things would be vitamin deficiencies or insufficiencies of certain micronutrients. Really doesn't happen that much or not very severely with the sleeve procedure, but it can to a small degree, and certainly things like iron and B12 and vitamin D can sometimes drift and get a little low if you're not supplementing them. Usually with the sleeve it's very easy to supplement it just by following your doctor's instructions and taking those vitamins on a regular basis. After that, the side effects and complications of the sleeve procedure are pretty few and far between. There really isn't that much. There's a little bit of eating discomfort, a little bit of abnormal bloating, gas, kind of things with digestion. Most of that is early in the early weeks or possibly months after the procedure, but it tends to dissipate and not be a problem going long term. You might throw weight regain into the mix as a side effect or complication, even though it's sort of more like an inadequate treatment of the underlying problem, and that's true with all of the procedures. Possibly a little bit more so with the sleeve when you look at very long-term data, because it is the least aggressive of the procedures. So that's kind of a quick summary on the sleeve. With gastric bypass surgery, which is the #2 most widely performed procedure, the list is much, much longer. Doesn't mean that everyone's going to get a lot more side effects and complications, but it's a much longer list. So it would include the things I just mentioned, and definitely a more severe version of the vitamin deficiencies. And that can lead to things like much more significant hair loss, possibly some skin changes, sometimes some nutritional breath or body changes related to micronutrients having been not absorbed as well. And occasionally a need to even get in vitamin infusions or iron infusions because of low vitamins or mineral absorption. In addition, there are side effects with the gastric bypass that can occur that are related to Motrin intake or alcohol intake, and that can form ulcers, gastritis. There's something about that connection of the stomach pouch to the intestine that's very vulnerable to developing ulcers and gastritis. So we always tell people really no taking nonsteroidals, Motrin, Aleve, ibuprofen. We prefer to say at all, but certainly minimize it. And then alcohol is really also something to take, very minimally. That's a bad combination, alcohol and nonsteroidals, that causing very severe ulcers in some cases. I would also put steroids, good old prednisone, in that same category of being very risky for after the gastric bypass at causing ulcers. The gastric bypass also is a rerouting of the intestine, and there's a way in which the person can develop a blockage or an intestinal obstruction. Something called internal hernia can occur. It's, again, a small fraction of people. It's a fairly rare event over the years, but it's something unique to gastric bypass, and it could require surgery to resolve. Something that's a lot more common but a lot less serious is something called dumping syndrome, which is fairly unique to gastric bypass. It's most classically when we drink sweets like concentrated orange juice or have some ice cream that has a lot of sugar, and it goes into that little gastric pouch and then it immediately dumps or moves right into the intestine, and there's a change in our bloodstream and some chemicals that cause us to get flushing, hot flashes, palpitations, and feel kind of woozy and yucky. And that dumping syndrome, that strange feeling, can last a few minutes, or in a few cases it can last many minutes or even hours. Generally, people learn pretty quickly what sets it off, and they avoid those things, usually sweets, to avoid getting the dumping syndrome. Not everyone gets it, but maybe a third of people do get it after gastric bypass. So that's a pretty good outline for starters of the list of things that gastric bypass could result in terms of side effects. Again, it's a small fraction of people who develop any of those one things. Collectively, there's a few more things on the list than there are certainly with the sleeve procedure. Next, I would just mention duodenal switch as possibly the third most common procedure. It would have many of those same kind of overlapping side effects that I just mentioned, minus you really don't get the dumping syndrome. But what does come with duodenal switch most commonly is diarrhea. That can be a real side effect that can sometimes be a real nuisance, kind of smelly, and really a frustrating one that sometimes can be hard to stop or control. It's usually worst in the first month, and it oftentimes settles down and becomes more normal after a year or so, but not always. Sometimes people really need to take Imodium or antidiarrheals for the long term in order to solve that problem. But the same potential trouble with vitamin malabsorption, vitamin deficiencies can happen, and that can lead to the same things in terms of skin changes or some hair thinning, things like that. So those are kind of the big three in terms of the main procedures that are performed. I might mention the lap band, even though there's not many lap bands performed right now in the United States or around the world, but its main side effects would be food sticking and problems related to the mechanical device itself, and that would include eroding into the stomach wall, which is kind of a serious problem that needs to be surgically removed. But a lot of food sticking, acid reflux type symptoms, esophagus getting stretched and stressed, that are all kind of obvious things related to the band encircling around the upper stomach. That's really where most of the side effects come from. A few more can come from where the port lives on the abdominal muscle wall, and that can create some discomfort for people. So that's really kind of the big picture of what the potential side effects are. I would say that even in the worst case, those side effects are pretty small compared to the side effects of morbid obesity. And even though that sounds a little crazy if you're living your life and your BMI is pretty high and you've kind of learned to live with excess weight, the truth is that the health and medical problems that are associated with that excess weight far exceed all the things I just mentioned there. And so that people actually live longer, healthier lives, and they're in the hospital less, they have less mortality, they have less really serious health problems after the surgery, even despite all those lists of potential side effects. So important to kind of weigh the ledger and look at it carefully, but also be honest about looking at both sides of that equation. All right, I hope that's helpful in giving you kind of a sense of what that potential list of side effects or complications are. And as always, I wish you the best of health.